thin skin, thick skin. You notice that at the top, right here? What's that all about? Well, it has to do with you being able to assess the patient's skin so that you know how deep to put your needles. Let me give you the trick to it. You treat all your patients as if they have thin skin when you're starting. And I like to treat starting with the cheek because it's normally the area where you can go your deepest level of penetration because it's the thickest skin on the face. And what needle depths are we going to go to? Look at it right here, 1 millimeter. Can't want it easier than that. So obviously this is not problem specific. This is more protocoling the treatment. So if I have a patient with melasma, do I need to go to 1 millimeter? No, right? But this is just for you to grasp how you do the treatment. So look at this. We're going to start at 1 millimeter, okay? Then we're going to move from 1 millimeter and we're going to give 80% of that over this area right here. What I've found is once you approach a bony area on the face, it tends to be more tender, and the skin or the fat layer between the skin and the bone is diminished. So that means you will want to decrease your needle depth. So if I'm 1 millimeter here, when I'm going up here, I'm going to be decreasing to roughly 0.8, maybe 0.75, okay? Then from here, I'm going to go up to the forehead. So I move in this kind of motion, okay? When I go up to the forehead, I'm going to start at half of what I did on the cheek, right? So if my clinical endpoint was achieved at 1 millimeter over the cheek, I will start at 0.5 when I start addressing the forehead. Now, when I start addressing the forehead at 0.5, what am I looking for? I'm looking for the skin response. If I do one pass and immediately I see some blood starting to come up, and this patient does not have rosacea, this patient is not on aspirin or any sort of blood thinner, I can very easily know my depth, you know, it's too much. If I have a rosacea patient, no matter what depth you go to, they're more than likely going to bleed. Why? Because rosacea is where you technically have an anomaly, and the blood vessels, which should be in dermis, you have a few rogue ones traveling through epidermis. Okay? Kind of like sclerotherapy. If you guys have done sclerotherapy, you'd be more abreast with that, that whole concept, right? So look at this. So 1.8, 0.5, and then we're now coming down. So half of what we did here is going to be our benchmark for the nose and to go around the mouth, the lips, okay? So we're now at 0.25. Going over the jawline, I like to use the same depth as I did for here. So we would be at roughly a 0.8. Okay? When you're coming out of the face, you're going to be doing neck. Guess what? The neck tends to not really have bony prominences. So I would go and do the neck at the same level of penetration that I did on the cheek. And then as we progress down to décolleté, obviously, you know, you could look at doing the same thing. Either the same level as the cheek, or you may need to go a little bit deeper.